This week on Jerusalem is becoming a medical tourism destination, why they're preparing, and what Israel has to offer. Welcome back. Each year, thousands of people combine important medical procedures along with travel to exotic locations. It's called medical tourism. Some of those destinations include places like Costa Rica and India. But now a new company is putting Israel on the map for medical tourism. Stuart Katz, thanks for joining us on Jerusalem Dateline. You have a new organization called Isramedica, and talks about medical tourism here to Israel. First of all, can you tell us, Stuart, what is actually medical tourism?
Sure. Medical tourism is basically where a resident of one country goes to another country for medical treatment, either elective or required procedures. And it's something that over the past 8 to 10 years has rapidly grown and will continue to grow.
With different nations in different parts of the world, actually.
Right.
India, Costa Rica.
Right. For example, a resident of the United States may go to India or Costa Rica, as you mentioned, for medical treatment that can be obtained generally at a lower cost than what they could get at home.
Why Israel?
Why Israel? When we're standing here with Jerusalem in our background, I say, well, why not Israel? But Israel, in general, is about 60% less the cost of medical care for many of the procedures that we're offering than that they can obtain at home in the U.S. or in Canada. And it offers the opportunity to come and have your medical care, your procedures done, and at the same time enjoy a vacation in the Holy Land.
And so who are the people that you would like to interest in what you're going to be doing?
We'd like to interest anyone that has a medical procedure that they require, but particularly the American Christian that has had a desire, a yearning to come to the Holy Land, to visit the land, to walk where Jesus walked, to cure themselves in the land where Jesus performed so many miracles, and at the same time heal themselves while they're enjoying such backgrounds as the one that we face here.
And what have you done to help prepare the way, so to speak, and by contacting doctors and hospitals? What kind of infrastructure are you setting up?
We have a whole facilitation program in place already with the local hospitals, with the local doctors, with concierge services, with VIP services, that from the time the patient or the potential patient calls our offices in the U.S., we handle them every step of the way. Never leave them unattended by once we receive their medical file, sending it to potential doctors to review, being in consultation with their family physician back home or the specialist that may be required. Then after that, finding a hospital that they're comfortable with and that's able to handle what their requirement is. And then of course we deal with the aftercare as well. A patient is never left unattended.
And what kind of response have you had from hospitals here and doctors here in Israel?
The response at both ends of the spectrum has been very, very positive. The Israeli doctors that we're working with, many of them are expatriates, Americans or Canadians that have immigrated to Israel that are living here. Many of them were trained in the U.S. originally. So needless to say, they're very excited about the opportunity to be able to serve Americans that are coming over. The hospitals have geared themselves up to deal with the American patient, not only in terms of the quality of the hospital, but in terms of bedside manner that they're training their staff, able to provide what the American patient is actually seeking and expecting.
And when do you hope to start this program?
We hope towards the middle or end of the summer of 2012 to be bringing our first patients.
And what kind of response have you had from people that may have heard about this and maybe potential patients coming over?
So potential patients are, there is a certain amount of concern. They're traveling 6,000 to 10,000 miles to receive medical care from a doctor they don't know. And this is what we try to alleviate before they come over. We tell anyone that's not going to be comfortable that they're best off not coming to do the treatment. At the same time, we try to give them a sense of comfort. And for that reason, we do video conferencing between their doctor, their family physician at home, and the surgeon that's going to actually perform the surgery in Israel. We show them the hospital facility, exactly what to expect. It goes without saying that all of our patients that come over have single room accommodations. We try to set them up with a nice view. They have the best in the hospital facilities in Israel. And they meet the concierge, again, via video conferencing of who's going to be with them 24 hours a day. This is in addition to the doctors and the nurses for any need that they may have.
Although this is a new venture for you, you have a lot of experience in bringing people over to Israel. What have you been doing for the last
I've been for over 20 years in the tourist business to Israel, have brought hundreds of thousands of visitors from the United States to Israel to walk the land, to see the land, to feel it. And as I've often said, is my hardest challenge is bringing someone to Israel for the first time. Once they've been here, never have to get them to come back. They're always going to do that on their own. As the Ministry of Tourism says, you come to Israel, you'll never be the same.
I agree. Somebody who's been living here about 12 years, I would agree with that. Stuart, thank you for joining us.
Chris, thank you.